If you're guilty, watch this video before bed. Are you terrified of dying in unbearable pain, or does losing your limbs to leprosy scare you? It also reveals a nasty bacteria found in contaminated shellfish that can trigger severe cramps and diarrhea, eventually causing the immune system to weaken. 1. Noma cancrum oris. Ulcers form on the mouth, slowly eating away at the flesh until only yellowing teeth and jawbone are visible. This is not a scene from a horror film, but a condition called noma, which still kills 90% of impoverished children who catch it. Mostly found in Asia and Africa, bacteria gets into the body as a result of poor hygiene or contaminated water, causing the flesh on the face to become gangrenous and wither away. The disease, also known as cancrum oris, is rapidly progressing and affects the genital areas as well as the mouth. Once the condition was far more common, even in developed European countries and the United States. It was widespread among inmates in concentration camps during World War II due to the horrendous conditions. While it has largely disappeared from industrialized areas, without treatment, noma kills 90% of children who catch it. 2. Hemocystoma, aka Madura's foot. This is a fungal infection capable of spreading all throughout the body, but is typically found on the legs and feet. Initially, one suffering from this disease will notice a swelling on the foot followed by a discharge of pus. The fungus then spreads, causing huge eruptions all over the appendage and serious damage to the surrounding tissue. Eventually, this inhibits the use of the foot or leg. Madura's foot is actually fairly painless, which often leads to a late diagnosis. There are currently no vaccines to treat it, but it can be avoided by keeping your hands and feet clean, as well as emerging shoes while in fields and other natural areas. Although it is endemic in Africa, India, and Central and South Americas, it has also been found in southern U.S. states and in homeless people or those suffering with HIV. 3. Complex Regional Pain Syndrome, CRPS. CRPS is a disease which causes people to suffer severe pain, sometimes continuing and debilitating, and often at just a stroke of the skin. It occurs due to a breakdown of the nervous system and central nervous system. Studies also show that the pain and discomfort caused by CRPS can lead to mental health issues such as depression and anxiety. Symptoms begin to show after serious injury involving tissue damage. While it usually begins in the hands, it has the potential of spreading all over the body. Someone suffering from CRPS will feel burning and stabbing pains or grinding and throbbing sensations. It can also cause numbness, swelling joint pain, and insomnia. This disease is treatable, although the road to recovery is a long and complicated one, involving physical therapy and sometimes surgery. 4. Leprosy. Leprosy is a contagious infection that causes inflammation in the skin, eyes, nerves, and respiratory tract. It is contracted from exposure to a certain type of bacteria called Mycobacterium. Symptoms can usually go unnoticed for years, resulting in poor eyesight, the loss of feeling in the limbs or infected area. As people lose feeling in their limbs, wounds and infections occur, and eventually they may lose parts of their body. Leprosy has been around for thousands of years, and in the old days they used to quarantine anyone with leprosy into leper colonies so the disease wouldn't spread. But modern science has proven that it's actually not all that contagious, so taking such measures did little to stop it. Leprosy is often referenced in the Bible, although scholars believe any biblical reference to the word likely refers to not just leprosy as we know it today, but also a wide array of diseases involving scaly skin. Over the centuries, there have been many methods of treating leprosy, including blood sacrifices of children or virgins and rituals involving snakes. Today, multi-drug treatment is available to rid victims of their sickness. 5. Filarial worm, aka Loa Loa worm. Filarial worm is a parasite that has the ability to live in people's eyes. It affects over 200 million people and is the second leading cause of blindness worldwide. Filarial worms are not just contained in the eyeballs, and when they occur elsewhere in the body, they cause a condition called elephantiasis, which results in the lower extremities swelling up larger than normal. Other potential symptoms include a rash, intense abdominal pain, arthritis, and papules. Curing filarial worm infections depends on exactly what type of filariasis one has and is often treated with antibiotics. 6. Vibrio vulnificus. This is an extremely virulent bacteria that can cause a severe infection. It is contracted through eating raw shellfish and swimming with an open wound, as well as stings from stingrays. This disease comes with many symptoms including vomiting, intense diarrhea, blistering dermatitis, and severe abdominal pain. To make matters worse, Vibrio vulnificus weakens the immune system, affecting both the liver and bloodstream and ultimately killing those who do not seek proper treatment. The origins of Vibrio vulnificus only date back to 1979. 7. Pica. Pica is a disorder that causes people to inexplicably gain an appetite for non-food items. This can range from anything from paper and wood to feces or urine. This can range from anything from paper to wood to feces or urine. This does not include people with mental disabilities or anyone who eats non-nutritious items for cultural or religious reasons, making it difficult to diagnose since it could potentially be caused by another unrelated disorder. Problems from pica can be quite severe. Feces and dirt cause health hazards. Additionally, someone with pica might ingest something toxic such as paint or lead, which can ultimately lead to poisoning. Please share and spread the awareness toward these scary diseases.